Welcome. If you've made it here, you're probably into health optimization and longevity. But if you're like a lot of people, you're maybe completely confused with all the information out there. Should you be doing peptides or different supplements or ice bath or infrared saunas? All these different things can be extremely overwhelming. And how do you know what's actually right? What isn't just a fad or a scam and just good marketing? Now, I am here to help you cut through all of that noise and figure out what is right for your unique biology and what the science actually back. Now, my name is Mirthe. I'm a precision health and longevity consultant based in London and also seeing clients worldwide. And I help people cut through that noise and come up with a very bespoke strategy that's unique to their biology and also to their preferences and goals and needs. Where do they want to go in life? I help people on both sides, people that already have issues, niggly symptoms, full-blown diseases, look at the triggers of what's causing these things in the first place, and also help people that don't have issues prevent running into them in the long run so that they can become very proactive and get into the driver's seat of their health trajectory. Longevity medicine, right? Now, the thing that distinguishes though is that oftentimes people then just give you different supplements, medications, tools and tricks to suppress certain symptoms. And the way I work and the way functional medicine looks at things is to look at the root cause of why things aren't working properly in the first place. Common example is chronic inflammation. A lot of people know that chronic inflammation is one of the big drivers of ill health, whether that is symptoms now, anxiety, depression, skin problems, hormone issues, digestive problems, endometriosis, sorts of things like that. And long-term, chronic inflammation has been linked to Alzheimer's and cardiovascular disease, high blood pressure, stroke, heart attacks, all these sorts of things. Now, rather than just throwing in another anti-inflammatory supplement or drug, which can work wonders, so don't just stop anything that you're taking. The bigger question, in addition to that, might be to say, where is this coming from in the first place? Why is there chronic inflammation in the first place? Because there's actually always a reason why. The body doesn't just do certain things out of nowhere. Inflammation, for example, is a really important tool to fight off infections and heal wounds. It's only a problem if it becomes chronic and lingers. Then it starts to basically rust out from the inside out. So the way I work is I'll look at different underlying factors to ill health, and then I'll look at why is this happening in the first place. So for example, there's this part of research called geroscience. It's big in the longevity world, and they're looking at aging as a disease, and they're looking at these hallmarks of aging called the 12 underlying factors, where they found that they actually interconnect and they lead to all bad health outcomes, whether that is Alzheimer's or cardiovascular disease or cancers and all these things, rather than one thing leading to one and another leading to another. They found that they all interconnect and contribute to all of them. And if we just address those, then we have better health overall and prevent ill health outcomes. Chronic inflammation is one of them. There are other factors such as maybe you've heard of mitochondrial health or telomere length or cellular senescence, also zombie cells, where cells just don't die when they should. Now, all of these are in these 12 hallmarks of aging, and they cause all these or contribute to all the big health issues that we have now and down the line. But like I said before, the bigger picture, in my opinion, is to then say, where is this coming from? Why are our mitochondria not working? Why is there inflammation? Why are our telomeres rusting? Why are there zombie cells? And there's usually always a reason why. And if you just dive into that and look at the person's unique biology with specialized testing, root cause testing, such as hidden food intolerance is causing inflammation, or gut microbiome issues, or chronic infections, or environmental toxins, they all contribute to cellular sludge and decline. And if there's just a little bit, not a big deal. If it accumulates over time, all of a sudden the whole body breaks and then a full-blown disease develops. It's a little bit like, you can think of it like cogwheels in a machinery. And I always think about that like that in our health. So if there's just a little bit of rust going in, usually all the cogwheels still work. But if there's a lot of rust and a lot of sludge, eventually all these different cogwheels grind to a halt and then nothing works anymore. So this could be a little bit of inflammation, a little bit of toxins, a little bit of nutrient deficiency, whatever, you name it, stress. A little bit of that, not a big deal. If it accumulates over years and decades, eventually all of that stops, and then our body has a full-blown health crisis. So the way I work is look at what's causing this rust, what is causing this decline, and if we can optimize that and prevent and take it away and support it, it's like an oil change where you're just cleaning out all these different cogwheels and everything can run smooth again, so that you feel better now and that you also prevent big health issues down the line. Now, if that is of interest to you, please reach out to my team, and I would love to look at your health, look at your overall strategy, see where you are at, and we'll come up with a bespoke strategy that fits your lifestyle, that fits your needs. So it's not getting rid of everything you enjoy, because what's the point in living longer if you're not enjoying it, right? So I always preach a 80-20 rule. 80% of the time, try and really optimize cellular health, keep it all flowing smoothly, and then the body can also get away with cheating a little, living a little, and having fun in life, right? It's a really important part of long-term health as well, actually. A lot of research into stress and vagus nerve. You might have heard about all these things, and it all plays into it. So we're really looking at a full 360 approach. We're putting all the pieces of the puzzle together. Another one that I want to address quickly, because people talk about it a lot these days, is DNA health testing. And I do believe in DNA health testing. Means it looks at your genetic predispositions that you're born with. And they can sometimes make sense and just explain why maybe you're running into more issues and you're doing the same things as your best friend or your partner or something like that, because maybe you just have some genetic weaknesses towards something. So sometimes that can become really empowering, knowing where your weaknesses lie and also how to support them, and also not be so hard on yourself. However, the way it's often used is that someone knows their genetic weakness and then they think they're doomed, which is not the truth. Or they think, okay, now I have a weakness there, I now need to take the supplement for life. Also not usually the truth, because there's something called epigenetics, which is around our genes. It's our environment that can actually decide which genes we turn on or off. So you might have a predisposition towards something, but you might not actually running that gene. You might have turned that gene off, or you might be optimally supporting it, so you're not having issues there. So then just blindly supplementing certain things could cause more harm than good, or making certain lifestyle changes that aren't even important for you because that gene isn't turned on. It might also be more stressful than good. So it's always important to combine all the dots, connect it from 360, look at the predispositions, but also look at where you're at right now and what makes sense for you from your personality perspective, so we can connect it all and come up with a truly bespoke, personalized and targeted approach that works for you, so that you can be in the driver's seat of your health trajectory and feel better now and in the long run, but also become the CEO of your own health journey and just really make educated choices that work for you, so you feel like you know what to do and you are in control of it. If that sounds like something you want to do, please reach out to my team. I would love to talk to you.